Hello everyone, welcome back to my channel. I am myself Dr. Rajesh Gubba. I am the general medicine educator. So in this particular session, I'll be discussing the quiz which I have posted on 30th of April on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. So in this particular session, let me discuss the questions of the quiz. So every day I'm posting the quiz on my Telegram channel, and on the subsequent days, I'm also sending you the explanation. So the first question of the quiz was: cortical blindness, amnesia, thalamic pain are associated with occlusion of anterior cerebral artery, basilar artery, middle cerebral artery, and then posterior cerebral artery. So if you see the explanation here, for the development of the cortical blindness, the site of pathology should be in the occipital lobe, right? And for the development of amnesia, the site of pathology should be the hippocampus, right? There are many other sites, but mostly the hippocampus, which is present in the deeper part of the temporal lobe. And for the development of thalamic pain, as the word itself tells you, the pathology should be within the thalamus. Now, these three structures, that is temporal lobe, thalamus, and as well as the occipital lobe, these are supplied by the posterior cerebral artery. So the answer to this question is the posterior cerebral artery, right? Next, you see the next question: which of the following is contraindication for thrombolysis in a patient of the ischemic stroke? So you have to remember, this question is very, very important and many times asked in the previous NEET PG and as well as INI CT and FMG exams. You see the options: blood pressure less than 185 by 100, blood glucose less than 100, CT scan showing edema less than 1/3 of the middle cerebral artery territory, platelet count less than 1 lakh. So the question is, which of the following is contraindication for thrombolysis? Now, among the options which has been given to you, platelet count less than 1 lakh is the contraindication for thrombolysis. Now, not only the platelet count less than 1 lakh, even the hematocrit, if it is less than 25%, it is also contraindication for thrombolysis. And what should be the glucose level for the contraindication of thrombolysis? The glucose level less than 50 milligrams per deciliter, or the glucose level more than 400 milligrams per deciliter, they are considered to be the contraindication for thrombolysis. And what should be the blood pressure for the contraindication of thrombolysis? The blood pressure, it should be more than 185 by 110 millimeters of mercury. That should be the contraindication for thrombolysis. And what should the CT scan show for the thrombolysis? Remember, if the CT scan shows edema more than 1/3 of the MCA territory, then this is an absolute contraindication for thrombolysis. So these are the contraindications for thrombolysis. And another important contraindications, this is a very, very important area for the questions, and you need to know this table, right? So the other contraindications are, if you observe very carefully here, that includes prior stroke or head injury within 3 months, major surgery in preceding 14 days, use of heparin within 48 hours and prolonged partial thromboplastin time, gastrointestinal bleeding in preceding 21 days, recent myocardial infarction, coma or stupor. These are the contraindications for the thrombolytic therapy, and this table is very, very important. You have to remember this table, and many a times questions have been asked from this. All right. Now coming to the next question. So blood supply of the paracentral lobule. The options are anterior cerebral artery, anterior choroidal artery, anterior communicating artery, middle cerebral artery. Now you take this paracentral lobule. Where exactly is it? This is present. This paracentral lobule, it is present on the medial surface of the brain, right? It is present on the medial surface of the brain. And which parts of the brain you have this paracentral lobule? This paracentral lobule, it is present in the frontal, the medial surface of the frontal, and as well as the parietal lobes. These are the areas where you have this paracentral lobule, and it is present just anterior to the central sulcus. And this paracentral lobule, that is the frontal lobe, it is supplied by the anterior cerebral artery. So paracentral lobule, remember, which is present on the medial surface of the frontal and parietal lobe, it is supplied by the anterior cerebral artery. And you also need to know what is the function of this paracentral lobule. And you have a subsequent question, that is A lesion in paracentral lobule causes contralateral foot weakness, seizures, migraine, cognitive loss. Now, paracentral lobule, what is its main function? So, remember, it plays an important role in controlling the movements of the lower limbs and as well as controlling the bladder. And not only that, it also helps in processing the somatosensory information from these areas. So, three important functions: controlling the movement of the lower limbs, that is number one. Next, bladder control. Third, processing somatosensory information. Now, whenever there is damage to this paracentral lobule, there is motor and as well as the sensory deficits. What will be that motor deficit? Such as weakness or loss of sensation in the legs. That is one point. And even there is also bladder dysfunction where the individual will have urinary incontinence. So if you go back to the question, what is the answer now? The answer will be contralateral foot weakness. And if there is bladder incontinence, even that also would be the answer, right? So that is about your paracentral lobule, which is supplied by the anterior cerebral artery. Now you see the next question. Antisocial behavior is the feature of damage to which structure? Prefrontal area of the frontal lobe, primary frontal area of the frontal lobe, premotor area of the frontal lobe, paracentral lobule of the frontal lobe. Paracentral lobule, just now we have discussed, if it is being damaged, the individual will have contralateral lower limb weakness and as well as the urinary incontinence. Now, for the development of the antisocial behavior, where should be the damage? The damage should be within the prefrontal area of the frontal lobe. Now, this prefrontal area of the frontal lobe, what is its main functions? So, the prefrontal area of the frontal lobe, it is concerned with the executive function. It is concerned in maintenance of working of the memory, decision making and social behavior. These are all the functions of the prefrontal area of the frontal lobe. So, if the prefrontal area of the frontal lobe, if it is damaged, then the patient will develop cognitive and emotional deficits. There will be difficulty in decision making, attention deficits, loss of impulse control, as well as changes in mood and social behavior, which is nothing but the antisocial behavior. So remember now, very important question, antisocial behavior will develop whenever there is damage to the prefrontal area of the frontal lobe. So these are the 5 questions in the quiz which I have posted on 30th of April on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. So join my Telegram channel for daily quiz discussion, and you can follow me on Rajesh Gubba on Instagram for daily updates related to general medicine. Thank you very much. See you tomorrow again.